exercise is going to be the front squat. Now the front squat is a squat technique where the bar is placed in the front instead of the back, and it's going to be using mostly your lower body, so mostly legs. It's going to be your quads, your hamstrings, your calves, and it's really good for strengthening your legs as well as flexibility and motion in your joints, like at the hip, the knees, and the ankles. Um, Definitely keeps flexibility in check. And when we're looking at the front squats, as we will just assess in our patient in just a minute, we're going to really be looking to see if there's any a forward lean of the bar. We're also going to see if the heels come off the ground. Um, and we're going to see if he actually gets all the way down into the squat. So his knees need to be past parallel to the ground or parallel to the ground. So we're going to really be looking for those things in this next video to really assess and see if we need to have any corrective exercises for the patient um, in order to correct his bad habits or bad form, or maybe even make him more flexible. Okay, so our client here during the front squat was almost perfect in his form. So we're going to give him a couple exercises here to correct his weaknesses and improve on his weaknesses so that he can become better in his form and execution of the front squat. So this first one's going to be a deep squat progression. He's going to go down, grabbing his toes with straight legs, then he's going to bend and sink his butt down into the squat position, knees parallel, or thighs parallel. And then he's going to take his right arm and extend it up, looking straight back towards his arm, and then bringing it slowly back down to that foot. He's going to do it on the left arm as well. Bringing it back down, and then come back. Then he's going to stand back up and turn to his right. Then we're going to show you the side angle of this. So again, straight legs, coming down, touching the front of the toes, going down into the squat position, raising your right arm back, bringing it back to the toes, and the left arm. And that's the deep squat progression for the front squat. Okay, so for our second corrective exercise for a front squat, we're going to be doing this drill called the lateral wall drill. So our client's going to go into a squat position a little bit with his knees bent. And he's going to rotate the hips and throw the ball against the wall, catching it and repeating the process. What this is going to do is it's going to help with stabilizer muscles and hip mobility and flexion at the knees. Okay, so we're here back with our client, and this is going to be our third corrective exercise progressions for the front squat. This is called the overhead deep squat pass. So our client's going to go down into a squat position. He's going to raise the ball over top of his head, throwing it on the ground and bouncing it back off the wall. He's going to do it again. So what this is doing, this is working stabilizer muscles. It's helping with knee and hip and ankle flexibility. And it's also strengthening those muscles to help with the front squat. The next exercise we're going to discuss in the core 4 is going to be the overhead squat. And the overhead squat is a lot like the front squat in that it's going to work mainly your legs, like your quads muscles, your hamstring muscles, your calves, but it's also going to, just like the front squat, work the mobility of the joints of the hips, knees, and ankles. The difference in the overhead squat from the front squat is going to be mainly that the bar is going to be over your head, so it's going to be working stabilizer muscles in the shoulders, hips, knees, and ankles. A lot more than the front squat is. having the weight over top of your head is not going to allow you to fully do as much weight as you would in like a front squat. This is good for working on stabilizing muscles, and we're going to assess the same as the front squat. We're going to watch to make sure that the feet don't come off the ground. It's going to be easier to see if there's a tilt in the bar, being it over top of his head. And we're going to make sure he goes all the way down to parallel with the floor with his knees. Okay, we're back here with our client. This is going to be exercise progressions for the overhead squat. The first one's going to be the standing chop lift with a medicine ball. What the client's going to do is going to go down to his knees, squatting down, coming back up with straight arms, turning the hips, and then coming back down to the squat position. What this is going to do is it's going to help strengthen those muscles that for squatting and making it more explosive, along with stabilizing muscles when he has to come back down and back up to hold that ball stable. You can see also that he turns his foot. Okay, our next corrective exercise for the overhead squat is going to be our dorsiflexion stretch. What's going to happen is our client is going to put his foot flat on the ground. Normally you'd have a pole or something to hold onto here for stability purposes, and he's going to just lean forward into his foot without letting his heel come off the ground at all. He's going to hold that for 10 seconds. Get a good stretch in there. This is going to help him from not coming off the ground with his heels when he does his overhead squats. As you can see in the video when he did his overhead squats, his foot did come off the ground a little bit. Both of his heels did. So he's now going to change over to the other side and do the same thing on the other side. 10 seconds again, leaning forward into the stretch, making sure he feels a good stretch there. And again, this is for dorsiflexion stretch to help prevent the heels from coming off the ground. All right, for our next corrective exercise for the overhead squat, we're going to do the toe touch. So our client's going to come straight-legged, bending down and trying to touch his toes or as far as he can. What's going to happen is without any bouncing, we're going to have a nice stretch in the hamstrings. And so with the stretch in the hamstrings, it's going to allow for a deeper squat and more explosive when he is coming out of the squat. This is again for the overhead squat. This is the toe touch. Our next exercise is the Romanian deadlift. The Romanian deadlift is a form of the deadlift that keeps the legs a little bit more straight, and it starts from the top instead of the bottom, from the weight being on the bottom. The main muscle groups used here are going to be the hamstrings. Your quads are going to be used a little bit in this one. The trapezius and erector spinae are also going to be used. You're going to want to keep a tight core, so your abs are also going to be a little bit used here. But mostly it's working the lower back and your back muscles. So what we're going to look for in this is make sure that the patient keeps the bar close to their body and that they keep their back straight. So we want a straight line from the back of the head all the way down to the butt, making sure that it's tight and so we avoid any injury. Okay, now for our next corrective exercise, we're going to be doing the Romanian deadlift. This is going to be called patterning the deadlift. This is going to help with hinge and hip flexibility. So we're going to place one arm behind the back and one arm over the back. A dowel will be optimal in this position. So keeping the head and spine straight. You're going to be shoulder width apart, and without flexion at the knees, you're going to bend over. You're flexing the hips, keeping the back straight and going as far down as you can, touching your butt to the wall, and then coming back up, and then repeating. About 10 of these would be optimal, and again, it's going to help with hip flexibility and mobility for the Romanian deadlift. All right, so back to the Romanian deadlift. This is called cooking the deadlift. So the deadlift is, or the kettlebell is going to be placed neutral with the hip, so it's going to be back farther than you actually think, and you're going to scoot up on it, and you're going to go down into your deadlift, grabbing and squeezing on as hard as you can onto the handle of the kettlebell. Then you come back up into a straight up and down position. You can see how his head, shoulders, hips, knees, and ankles are all in a straight line. It's not too far back, it's not too far forward. He's in this neutral position, straight up and down. Now he goes back to set the kettlebell down, and he's going to want to reach back farther than he actually thinks to put it back in the same position that he picked it up from. Now you don't want to put it too far in front of you, but you want to get it back there enough to actually get down into that deadlift. A good coaching tool would be to put a piece of tape, like where the kettlebell begins, and so that the client knows where to put the kettlebell when he returns. Okay, this is going to be the single leg toe touch lift. It's going to be for the Romanian deadlift as well. This corrective exercise, you need a dowel, and you're going to have the dowel touching on 3 points: the lower back, the upper back, and the back of the head. Making sure you have full contact there through the entire motion. This exercise is going to help with hamstring flexibility, along with hip mobility and flexion, and keeping your legs straight when you're going into the Romanian deadlift. So now what it's going to do is going to take one leg back, and he's going to go low down into the deadlift, keeping his back as straight as possible, and then returning to the position. Doing it again. Now he's going to switch hands around. So yeah, one goes up, one goes back down, and he's going to then do it to the other leg. More time. Again, keeping those legs straight so that the hamstrings can be stretched out. As again, the toe touch lift, one-legged lift for the Romanian deadlift. Our final exercise of the core four is the jumping high shrug. The jumping high shrug is the most explosive exercise of the four, and is going to consist of the client having the bar on the ground and exploding up from the squatting position into a shrug. Now he's going to keep the bar close to his body as he can, and when he's coming out of the squat position, he's going to be exploding into this shrug. So he's going to be using his calf muscles as well as his quads mainly. And when he gets the weight up into a neutral position of when he's standing, he's going to then shrug his shoulders up and then releasing and bringing it back down to the floor. What we're going to look for here is make sure that the client has a straight back. We're going to make sure his arms are straight and make sure he gets a full shrug up into the exercise. Also, we're going to make sure that he's exploding with this exercise, like his feet are coming off the ground. This is a good exercise for the quads and shoulder muscles, the trapezius, as well as the calves. Okay, our next movement is it's a corrective exercise for the jumping high shrug. These are going to be just kettlebell, or you can also use dumbbells. There's going to be shoulder shrugs. So we're going to go lightweight, correct form, and slowly lift up on the shoulders, shrugging it and holding in that position. This is going to strengthen the muscles of the shoulder as well as stabilize them. We're going to want to do lightweight, not heavyweight, so we don't risk injury before actually doing our exercise. You're just bringing it up, shrugging the neck, or shrugging the shoulders to the neck, and then lowering it back down. Okay, so again with the jumping high shrug as a corrective exercise, it's going to be the gastrocnemius and soleus stretch. Placing your one foot against a wall or upward surface, probably at a 45-degree angle. We're going to just lean into that stretch. This is going to really stretch out the gastrocnemius and soleus to make up the calf muscles. What this is going to do for our jumping high shrug is when we're exploding off the ground, it's going to give you more range of motion to explode through your jump, enabling you to have a better jumping high shrug. Now it's going to switch to the other leg. Do the same thing. And when you're leaning into this, you don't want to bounce, rock back and forth. You want to hold it straight up or just hold the stretch there for 10 seconds, and then release it. And then I'd say about 3 reps of this will be about necessary to correct this stretch. Okay, our next corrective exercise for the high jumping shrug is going to be the standing rectus stretch. Patient's going to have it on a chair or a ledge, put their back foot on that, and then slightly bend the front knee. Doing this is going to put some pressure on the quads or the rectus femoris in the leg that's slightly bent, and in the back leg, it's going to give it a little bit of stretch on the quads. So you're going to now switch to the other leg and repeat the same process. Remember to keep your hands on the hips, slight lean forward, and now bend that leg a little bit. Yeah, and keep your back straight as well when you're doing this. So it's really going to give it a nice stretch to the back leg and put some pressure on the front leg to strengthen the muscles there. This is again for the jumping high shrug, and this is the standing rectus stretch.